Hello, good afternoon. How are you doing? Still enjoying my holiday? I hope you are enjoying yourself as well. It's good to be on holiday. So today I have come to make this video, and this video is regarding piles or hemorrhoids. The reason I'm making this video is because it's so sad that my people back in Africa are dying of piles. And one of my brother cousin, spoke to me about yesterday or 2 days ago that guys are dying from piles, ladies are dying from piles. And he asked me, what could be the cure? From that time, I felt really bad. I really felt, restless to know that, things that can just be managed, or can be self-limiting, is taking so many lives. And also, I just got to know that my baby cousin just died just a few days ago. And she's just like maybe in her late 20s or early 30s. And she just died of pile. A little girl. So, and that got me thinking, I'm like, okay, I'm just going to use this, my little time in my holiday, to make some videos. And please, share this video. Keep sharing this video. Once you see the video, keep sharing it until it gets to people that actually needed to see this video. Keep sharing the video, please. And God will bless you. So today I want to talk about piles or hemorrhoid. And in my language, I'm going to be mixing this video with some Ibibio and Efik language. So if I get to speak my language that's fine for me. And I'm not sure about you. So if you need translation, I'll do. So pile, as we know about it, a lot of people call it pile. In my language, they call it asemebot. So, it's a disease that happens in your back area. In the back area, what I mean there is in your anus. Whether it's a male, whether it's a female, pile happens in the anus. And how did it happen? Majority of the time, the etiology. Etiology means the origin of how pile actually arises, remain unknown. But there are a lot of risk factors. There are so many things that predisposes an individual to having the sickness of piles or hemorrhoid. So, and this is happening in a place that is very private, that people are so scared, they're so shy, they don't even want to speak to a doctor about it, and they keep it to themselves until eventually die from it. And I believe that some of them that die from piles, they die from sepsis, and they also die from bleeding, excessive bleeding that leads to anemia, because they are concealing this problem. So pile happen when some blood vessel engorged, when some blood vessel engorged from your anus and also around the rectum. So, your alimentary canal is from your mouth down to your anus. And then we have the sigmoid, we have the rectum, we have the anus, and all of these places are lined up with blood vessels. So when pile happen, like I said, some of them, the origin are unknown, but majority of the time when pile happen is because there's a blood vessel that is bleeding. And like when you're bleeding, sometimes the bleeding form like a cloth, and then they form like a pocket, because the blood vessel engorge. I don't know how to explain it. The blood vessel engorge and is bleeding, and then from the bleeding it now develop some cloth that can also become fibrotic as time goes on. Fibrotic means that it can become something that, like bring out pores and all those things. So when you see a pile that come out like this, we have what we call a blind pile. We also have pile that is open pile, the one that you can see it in your tissue paper. And we have stages of pile. There are some pile that are blind pile. So when you go to toilet, you only see a little blood that come out of it, and sometimes you may feel it, and then when you finish, it's gone in. But when the pile actually is out, when the pile are out, that pile are blood vessels. They are blood vessels. They are arteries. There are arteries that are bleeding in one area. Some of them can be two. We call it bunch pile. They can be two. They can be three. Blood vessels that just engorge and they bleed inside and then they bulge out. So it's not anything else than blood vessels that are engorged, that they bleed inside and then they engorge. So, do people die with pile? Ignorance will make people to die with pile. Because like in the area I come from, a lot of people are always scared of going to hospital, going to see a doctor, or speaking about their problems. So that's how they will end up dying from pile. But pile is something that you can manage, you can live with it. I know someone that actually manages pile. How many years have I known him? For over 18 years. And he's still living his normal life and going his way. So pile can be managed. So now how can you manage? Okay, what are the risk factors that could lead for you having this pile? According to research, science have picked up few risk factors that predisposes a person to sustaining this disease called pile. One of them is obesity. Like you are obese, that means you're putting a lot of pressure because of your weight, putting a lot of pressure on your lower area, and that will also lead to pressure around your anal area. And also, if someone is overweight, sometimes they feel lazy to go to use the toilet. And research have also shown that the more you delay to go and visit the toilet, when you need to go to the toilet and you do not go to the toilet, right, what happens is that when you feel the urge to go to the toilet, at that time your physics is soft because it's mixed with water and other mucus, and they're ready for them to go out. But when you refuse to go to the toilet, the sphincter muscles around the anus absorb those moistures back into circulation. Excuse me, sorry. Absorb it back, and then the fecal matter is left so dry. So, and now maybe you refuse to go, and then you have eaten again. Another roughages from your food has developed another feces, and the old feces is on the new one is on top of the old one, and maybe you still refuse to go. And now when that stool have stayed there for a long time and there is no fluid anymore, so you get into what we call constipation. So when constipation happens, especially with some people that are obese as well, when constipation happens, that means that when you are going to toilet, you're going to put extra strain. You're going to strain your muscle, you strain your rectum for you to be able to pass the stool. So in that process of you straining your anus to be able to bring out one stool, you are forcing the arteries to bleed, and the bleeding will eventually, that straining your pushing hard will cause pile to happen, because the arteries around your rectum and anal area will start bleeding, and some of them don't bleed out. When they don't bleed out, they start to bulge out. Okay, so constipation is one thing that could predispose somebody to having pile, and also not obeying the law of nature. When you supposed to go to the toilet, at least go to the toilet. That's number 2. Number 3, again, is lifestyle. So lifestyle of eating so much hard food that are so hard. Like, for example, I am going to use the example, like in my place we have gari. We love to eat gari a lot, but you find out that some people will make this gari, and the gari will be so hard, and they say, when I eat that gari that way, I'll be able to, it makes me stronger. It does not make you stronger than someone that eats soft gari. Okay, all of them goes to the same gut. But the problem is that by the time you put so much hard gari, you're giving your intestine a hard time to turn those things into chyme that will now be absorbed into your small intestine. Okay, but you keep eating food and you don't drink enough as well. When you eat that hard gari, you eat that hard yam, and you finish, you eat a hard plantain, and you finish, and you eat dry toast. You're making toast and eat dry toast, and you're not drinking water. At the end of the day, they're going to form a very large bulky stool. A very large bulky stool that'll be so hard for you to push it down. Okay, so when that happens and you go to toilet, you're going to be straining a lot for you to be able to push out that stool out into the toilet. And in the process of you straining so hard, bleeding occurs. Some bleeding bleeds out, and you see it bright red in your tissue paper. When you're cleaning your bum, you see it, oh, I'm bleeding from my anus. Okay, bright red. And another set of bleeding happens, and they are not bleeding out, so they bleed into the vessels, and there could be 3 or 4 of them, and that is what form the pile. So you find out that lifestyle is a very important factor that results in this pile. And I want you to share this video until a lot of people hear it. Although the origin is unknown, but our lifestyle and sedentary lifestyle, that you will sit in one position. If you're a secretary or you do a job, like sometimes I work from home as well, but sometimes when you sit down in 1 hour, take 10 minutes and move around. Sitting in one position for a very long time is also a risk factor to pile. Because when you sit down for so long, even if your nature asks you to do number 1 or number 2, to go to the toilet, and you refuse, like I explained, the poo comes with moisture. When you refuse to go to toilet, all the moistures are reabsorbed again into your blood, going back into your circulation, and the poo will be left so hard. Some people have been ignoring the law of nature. When they say go to toilet, they say, no, I'm very busy. This is a risk factor to pile. Not drinking enough water is another problem. How many times did you drink water a day? Some people drink just a glass of water, and once they're done, they say, I'm fine. You need to drink, although I have said it in one of my videos, that you need to drink according to tests. But if you know that you're someone that is prone to having constipation, try to drink enough water. Drink at least 6 to 8 glasses of water a day. Before you leave your house, have water bottle in your car and drink enough water. So anything you're eating, you have enough water that can push it and get into circulation for it to be properly digested. Water is very good for our health. We have what we call interstitial fluid. When you drink water, it boosts your interstitial fluid, it boosts your circulation, it boosts your overall health. It also helps with your kidneys, to be able to filter out the debris and also toxin substances from your system. So when we don't drink enough water and we eat those yam, plantain, green plantain, yam, gari, and all this hard food, and we don't drink enough water, it will result in pile. And smoking as well. Smoking is not good for health, and it also is a risk factor to all these problems, including cardiovascular disease as well. So I've mentioned a few risk factors that lead to pile. Now I'm going to be talking about what we prescribe as a doctor. What do we prescribe for patients? We see patients every day coming with pile. So like I said, pile is not a deadly disease, but it's lack of knowledge that make people to die, and people being ashamed to share their problem. Don't be ashamed to share your problem. Go and show it to your doctor. Anybody that have been trained from medical school and they came out, they know exactly what to do with pile. The first option is lifestyle. We call it lifestyle management. Lifestyle management, or we call it self-limit or self-limitation. Self-limitation means that the things I've told you that the things that causes pile, then you start to change your diet. You eat enough fruit and vegetable. You need enough fiber. Like in my language, we said what do you call it in my language? Ikong ubong, all those ikong ubong. I can't remember all of it, but ikong ubong is the one I remember very quickly. There are a lot of atama, return. I'm remembering now. Cook them and eat them. You don't really need to use fufu or gari to eat this soup. Just cook enough of ikong with soup, with fish, with meat. Sit down and use your spoon and lick it enough and fill your stomach. And if you're going to eat gari, make it very, very soft. And just dip the gari in the soup. 5 or 6 balls of gari, and make sure you eat. Even if you want to eat more gari, make it very soft, like someone that is coming from surgery. You know, when you do operation in the hospital, with the doctor tell you, make sure your gari is very soft. The reason is so that you will not strain when you're going to toilet, because the straining you're straining like that to go to toilet is what actually causes the hemorrhoid, the pile, asemebo, all those things. That's what causes it. So when you eat your food, eat enough of vegetable, eat enough of fruit, drink enough of water. And that is what we call lifestyle modification. Stop smoking, stop drinking alcohol. Okay? Change your lifestyle. Eat healthy. And then, after you finish that, you can also have what we call arose. Arose is a cream. I think, not sure if I have it, if I have one here. If you just wait for me, I'll check if I have it around my first aid box or something. I bring and show it to you. Just hold on 1 second, I'll be back. I'm coming. Oh, sorry. I'm not sure who is watching. Sorry. I can't find it, but I'm going to use example like my cream. Yeah, so I can't find it so bad. Anusol is a cream that is like this. Okay, and I think this is a cover. I'm not sure if it's a cover to Anusol, but I know Anusol is a cream that the tip of it is like this, and then the tip will be covering on the cream. So what you will do is for you to press this cream like that, put it in your hand. You have to wear gloves and apron. So I'm just gonna use this my cream, okay, to show you. cream is finished. Tell me about it. Okay, so I have a little cream here. All right, so I'll finish it to buy a new one. So like that, but you need to like have it enough, but you need to wear gloves in your hand, gloves, so you put it like that in your finger. Go and buy anosol in the pharmacy if you're having pile, whether it is the blind pile, the one you don't see but you see bleeding happening there, or whether you're also having the one that you can feel when you're wiping your back area. So you take it like this, and then you bend down, and then you put it inside. You don't only rub it on the outside, okay? You don't rub it on the outside. I have so many things here. See, you see like this, my little thing here. So instead of rubbing it just outside here, okay, you don't rub it on the outside. So you need to like go inside and then push it in and rub it. That's why I say you need to wear gloves. Remember, physics can bring hepatitis, so you need to wear gloves and then push it inside, okay? And then that will help you to go inside. And if you're married, if you're someone that is married, you can tell your wife to do it for you. It's a question of you bending forward, and then your wife will have enough cream and put it on inside your bum. So, and you can apply this cream, the anosol cream, morning and evening. Once you apply it morning and evening, it will also help to lubricate your rectum and the anus, and also will also help to soften your stool as well. It will help the passage to be very smooth, and then it will reduce the bleeding, because the bleeding that happen in hemorrhoids, because every time your stool goes there, it brushes through the arteries and then they start bleeding. Every time your constipated stool goes there, it brushes through the artery and they start bleeding. So if you put that cream, it will help to moisten the stool and make it soft to come out. And then we have a pessary. So a pessary is like a long tablet like that. So anosol, a pessary, it comes in a packet. You can buy it in pharmacy. You break it out. If you're living at Uyo or you're living in Calabar, find a pharmacy. If anywhere you're watching this video from, find a pharmacy and you are having pile, please find a pharmacy, buy anosol pessary, insert it inside your anus like I did. Open the pessary, bring out the tablet and put it in your anus. If you're alone, if you have somebody, you bend down and they help to do it for you. There's no shame. If you die with that, is your problem. But if you do it, have a wife, have a girlfriend, they love you, they can help you to do that for you. Okay? If you want to be going to insert it in the clinic, it's fine. But you'll be charged money, you go and insert it. And then you go your way. And it will also help to soften your stool and also reduce the friction and also allow smooth defecation. So I have said that. Now the next important thing I have to say is that some people are having this bleeding coming out of their bum area, and also they don't even see that, they don't see the pile. You cannot assume that bleeding is because of pile. There are so many things that could cause bleeding, and one of them is colon cancer. Colon cancer can cause bleeding. Bowel cancer, the one from your stomach, can cause bleeding from your anus area. So what are the signs? So if you are bleeding from your anus, and when you put your tissue you can see bright red blood, that means that the bleeding is around the anus. So it could be something like a stricture or fissure or fistula that is happening there, or it could just be like constipation, just tearing one of your arteries around your anus. Well, that's not a problem if you put lubricant, or like what I've said, like emollient, like that, or the anosol, is fine. But the dangerous one is, look in your stool. If you see bleeding in your stool when you're going to toilet and your stool is mixed with blood, number one. And number two, if you use tissue paper and wipe your bum and you're seeing that your stool the blood is very dark in the tissue paper. When the blood is dark in the tissue paper, it means that that blood is coming from somewhere. It could be coming from the upper GI tract. It could be that maybe there's a peptic ulcer that is up here, is bleeding, and that blood that is coming out dark is a digested blood because it has traveled a long way to come down to your anus. That's why it's dark in color. You can also see dark blood. When you see dark blood, your stool is mixed with dark blood. It can also be a sign of bowel cancer. It can also be a sign of colon cancer. And another thing you have to notice is when you see those dark blood your stool is mixed with blood all the time, also checking yourself. Are you losing weight? You're not doing weight loss program. You're not intentionally losing weight, but you find out that every day you're losing weight. That's an alarm that something is going on, something sinister is going on. Okay. And then again, the next one is night sweat. If you go to bed and you're sleeping and you wake up, your whole bed is soaked with sweat. That's another alarm bell that something is happening. Okay. And the next one now is change in your bowel habit. If you used to go to toilet like once or twice in a day, or maybe once in every other day, because people move their bowels differently. People move their bowel once in a day, early in the morning, and that's fine. Some people do it twice a day. That's fine. But if you find out that the bowel habit has significantly changed, maybe you're doing it more often, or maybe you are doing it once in 3 days or 4 days, or maybe you're seeing a lot of diarrhea coming, mixing of stool and blood, or maybe you're having constipation and then diarrhea. We call it diarrhea with overflow. So if you notice any of this condition, you cannot just keep quiet and say, oh, when I go to the toilet, I see blood in my stool. That's a sign of cancer, a sign that something is going on. So if you go and speak to your doctor, the doctor will do what will send you to collect your stool. Will do blood tests for you. Will check your full blood count, also check your vitamin B12, folic acid, and everything. And then we'll also collect your stool, and we will test your stool for what we call fecal occult blood. So we'll check if it's positive of blood in that stool. Then we are going to refer you to the doctors. We are going to refer you to a procedure we call colonoscopy. Colonoscopy is a procedure that we have a very flexible tube, and on that tube there's a camera attached to it that has to go through your anus. And the reason for doing that is for your colon to be visualized. Okay, so we will be able to visualize from your colon down to all, from your anus, the rectum, to sigmoid, to colon. We're going to be able to visualize all of them to the ileocecal valve. The reason is we are looking for potential malignancy, anything that will cause you to have cancer, or maybe to look for where the bleeding is coming from. If we find out any changes in your colon, right, that area of the colon will be harvested, just cut, and then we'll send it to the lab for cytology to rule out cancer. Or if that is done, and then we find polyps is not cancer, but some of them, if you don't remove it on time, it can change to cancer. It can become cancerous. So we can remove the polyp, burn the polyp up, take the polyp also to the lab and study it, and then you're fine. So when you see blood in your anus, it's a very serious alarm. Don't ignore blood in your anus. It's not a joke. Seek advice of a doctor. And I have opened this clinic at Face. Don't be shy. Share your problem, and I will respond to you. Thank you very much, and have a nice afternoon. Bye. If you have any question, please share it with me. Please continue to share this video until it gets to everybody that needs this message. Thank you very much. Bye.